Welcome to Be Well. I'm your host, Dr. Candace Norcott, and I'm so glad you're here. Each week, we'll explore an issue and its implications for the mental well-being of you and your community. Then I'll be joined by a guest or guests who will help us take a deeper dive to broaden our understanding and compassion and share tools that could potentially reframe the issue to ensure our collective success and thriving. Finally, I'll leave you with some tips and strategies that I often use in my own practice. Remember, Be Well is not a replacement for your own therapy. However, I hope it can be a conversation starter when your therapist asks you, where should we begin? With that, let's unpack today's topic. Today, we're talking about a common question that comes up. What's the difference between a psychologist and a psychiatrist? I believe understanding who does what and how they can support you can make a huge difference when you're actually ready to seek care. So let's start with psychologists. A psychologist holds a doctoral degree, usually a PhD or a PsyD, and is trained in the science of human behavior, emotion, and thought. Psychologists are often the ones who provide talk therapy, helping people explore what's going on beneath the surface and supporting them through challenges like trauma, anxiety, depression, or grief. They used evidence-based approaches like psychodynamic theory, interpersonal therapy, or cognitive behavioral therapy. Often psychologists, like myself, have an integrative, flexible approach that can be tailored to a specific client's needs. Psychologists help clients build awareness, shift patterns, and develop tools for everyday life. Psychologists may also conduct psychological assessments that lead to learning or developmental diagnoses. But depending on the state, and unless they get specialized training in those states, they generally do not prescribe medication. Now let's talk about psychiatrists. A psychiatrist is a medical doctor, someone who went to medical school and then completed specialized training in psychiatry. Their work focuses on the biological and neurological aspects of mental health, and they're licensed to prescribe medications. If you're struggling with more severe or acute conditions like worsening depression that's not responding to talk therapy, bipolar disorder or schizophrenia, or even if you just want to explore how medication might support your therapy work, a psychiatrist might become part of your care team. Some psychiatrists also offer therapy, but many focus on medication management, making sure the medication is working well for you, adjusting dosages, and checking in about side effects or concerns. So I shared some basic differences between the two. Let's talk about trust. Because for many of us, seeking help from either psychologists or psychiatrists can bring up a lot of hesitation, and that hesitation is valid. In episode 2, my guest Kamisha and I talked a little bit about the long and painful history of mistrust between Black communities and the medical and mental health systems, from unethical experimentation to discriminatory diagnoses and treatments. Both psychology and psychiatry have histories that have caused real harm. For psychiatry in particular, there's often an added layer of concern about medication. Some folks worry that taking medications will change who they are, or that it's just a quick fix instead of being offered real care. Others have experienced being over-medicated or misdiagnosed, and that can leave deep scars. At the same time, psychology hasn't always gotten it right either. Cultural bias in therapy, lack of representation, and dismissive attitudes have made some people feel unseen or misunderstood in the therapy space. So if you've ever felt unsure about seeking mental health support, you are not alone, and your caution makes sense. But here's the good news. We're in a moment of change. More Black psychologists and psychiatrists are entering the field. More practitioners are being trained in culturally responsive care. And more people, maybe even people like you, are starting to ask questions, demand better, and reclaim mental health as something we all deserve access to. On the other side of the break, we'll be joined by someone who knows this work from the inside out, Chicago-based psychiatrist, Dr. Louisa Olushoga, who works right here in our community and helps people make informed empowered decisions about their mental health. Dr. Olushoga and I will talk about how to navigate psychiatric care, how to know when medication might be helpful, and how we can begin to rebuild trust together. Stay with us.
Hi, I'm Darius Hillman. Joining me on the next edition of In the Arena, the Inspector General for the City of Chicago, Deborah Witzberg. Take a look.
I'm a true believer in the power of government to do good. We owe Chicagoans a better government than the one they've gotten.
Join the conversation Tuesday at 7 p.m. on CAN TV 19 and streaming on cantv.org and the new CAN TV Plus app.
Each week on the Deep Dive segment, we'll take a closer look at an issue or challenge, reframing the way we think about it. We won't just explore the topic, we'll also talk about practical ways you can shift your perspective, whether in your own life or in how you understand someone else's experience. Taking us deeper today, I'm joined by Dr. Louisa Olushoga, a psychiatrist working right here in Chicago. Thank you for joining me again, Louisa.
Oh, of course.
Thank you for
it's
agreeing
my
to meet
pleasure.
with me. to talk.
Anytime.
So my first question is really, in the beginning segment, I was talking about the differences. How did I do?
You know what? You were talking and I thought I should be taking notes so I can sort of hand this out on a flyer, right? No, it was really good. One of the ways I sort of add to that description is I will tell my patients that, if you think of your primary care doctor, your OB-GYN, your dermatologist, and me, we all started at the same place. We all went through medical school and learned the anatomy of the body the same way. And then we branched off into our different specialties, mine happening to be with the brain. And so sometimes that gives people a little bit of a sense of how I'm thinking about things, because when my patients sit in front of me, I'm thinking about their mental health state, their depression, their anxiety, but also within the setting of every other medical thing that's happening in their body. Mm-hmm. So when we're making decisions about medications or anything else, I'm thinking about your liver and your kidney and what your thyroid looks like too. And in that way, functioning what seems and feels more traditionally like an MD or a physician, like their primary care doctor or OB or dermatologist even.
And it's helpful to give that background because you're considering all of that. The decision or the recommendations around medication are not knee-jerk, right? They're informed by that.
That's exactly right. That's exactly right. And I think, quite frankly, what I want my patients to walk away from when I'm working with them is just an understanding of how I'm making those decisions. Mm-hmm. They're not a dartboard that I'm just throwing things at and seeing what sticks and seeing if maybe I hit a target. There's some real intentionality about how I think about medication A versus B or no medication at all. And I find it's really important for my patients to have an understanding about that. It's their body, it's their system. They're the ones that have to take it every day. They should really understand what's going on and why it's happening that way.
Yeah, let's talk about some of the hesitations that you commonly hear or, in the course of your work or meeting with patients. Yeah, what are those hesitations, those worries, fears that you hear?
Oh, for sure. I often remind people that I'm typically not the first stop when it comes to mental health care and mental health challenges. My patients are typically seeing their primary care doctor who they might mention something or endorse a symptom. They might talk to a therapist or even a friend. And I think the biggest hesitation that comes with me is people are just afraid I'm going to throw medication at them or sort of drown them in medication. They just sort of become this medication zombie, or separate from the person that they want to be, a different person altogether, or adding this biological thing into their system that now is going to control how they feel or how they function. And I can appreciate all of that. I can see how we get to those conclusions. Quite frankly, psychiatry, like many medical specialties in healthcare, has been done wrong in many ways, and my patients have often been the victim of that. And so I think their fears come from a real place. Like it doesn't seem unreasonable to me. But I also think there's room for us to kind of have conversation about it and just interrogate that a little bit.
It can also be really powerful to name that history, right? And to acknowledge that, like, I'm a provider with that understanding too, and I want something different with you and for you.
Absolutely, absolutely. I find that my patients with whom I work, and have the strongest therapeutic relationship with is because we've taken significant time, maybe over the course of multiple appointments, to understand where their hesitations are. My biggest thing as a provider and as a psychiatrist is I really want to meet my patients where they are. It's important to me that we're making appropriate clinical decisions. I don't want to sort of throw it out the window, right, that I need to make the right decision in things. But it's important that I meet you where you are. It's not helpful if I'm 10 steps ahead of you and you've barely caught up to step 1. And so to meet you where you are sometimes means seeing you again and again and sort of joining you in this ride until we get to a place where we understand what's happening next, empowering you to make certain decisions the way you would like to make them. So I think both naming the fears and the hesitations, sitting with them, having conversations around them and incorporating them into education about treatment decisions can be really helpful and empowering for my patients.
Yeah, and two, so I do talk therapy, you're kind of the complementary medications. And so often what I hear is a psychiatrist prescribed me this medication, but I'm really worried about weight gain, so I haven't taken it. And if you're not talking about those things that make people hesitant, or if you're dismissive in that way, then somebody might take a prescription, but then they might receive a prescription from you, but then they won't take it.
Oh, that's exactly right. That's exactly right. And I'm so glad you bring up side effects, because that's a huge reason why people don't want to take medications, either because they've experienced them or they know family and friends who've taken them and experienced them, or they saw something on Reddit who experienced them, right? We know how the internet comes into play all the time, right? Dr. Google. And so absolutely, being able to have those conversations and have them clearly is just as important for that person to take the next step. Medications don't work on the shelf, and quite frankly, the truth is we don't know that they'll work for you at that dose, but we don't know until we try. And so we have to get through those barriers to actually get to the point to get the data that we need so we can make appropriate decisions moving forward.
Yeah, so you brought us right there. Can you share a little bit about how you take your patients from their hesitation to a collaborative work trial of medications and kind of work them through their hesitation?
Oh, absolutely. So the first thing I think is setting expectations, right? What are medications? What are they supposed to do and what aren't they supposed to do? I can have patient A who comes in and thinks I'm going to give them a happy pill and they're going to take it and tomorrow everything's going to be better, all their troubles are going to melt away. And that's not what's going to happen, right? And then I have another patient who is afraid that if I take this medication, all the terrible things are going to happen. It's going to awaken the side of me that's so awful. And so I really think setting expectations as to what medications can and can't do, what I expect to see as a clinician, what I'm hoping for you as a patient, is a really important starting point. And I tend to use this analogy in practice. And I can't say I take full credit for it. I'm sure maybe I learned it or adapted it from somewhere, but I talk about how a person with a mental health challenge, I liken them to being in a small sailboat, right? When you're struggling with a feeling or an emotion, it's kind of like being in a small sailboat out at sea. And really the goal is you're just trying to feel better. You're trying to get back to yourself. And so in this picture, you're trying to work your way back to shore. Now, what do you use? What are the tools that you can use? I mean, it depends, right? If you're in a boat, maybe you've got a paddle or a compass or a map. I don't know, maybe you can get out and swim and push the boat. I mean, there are all sorts of things and parts and tools that you can pull on to get you to shore. And that's great. And in my mind, I consider medication to be, well, that's all great, but if your boat starts sinking and you start drowning, it doesn't really matter how many tools you've got. It doesn't matter if you've got the paddle, it doesn't matter if you've got the right directions. If you can't breathe, there's no way that you can actually be in the mindset to choose a tool, use it appropriately, and get to shore. And so in this picture, I consider that when a person starts drowning, this might be the part where we have to think about medications as something to just bring your head above water. And I like that picture for a few reasons, because one, in that picture, medication's not bringing you to shore, right? It's not solving all the things, but it's doing something crucial, which is allowing you room to breathe. And then with that, you can start to use your other tools: therapy, diet, exercise, restorative activities, surrounding yourself by people who you love. There are all sorts of things that go into mental health. None of them are going to be able to be used well if you're not breathing. And so I typically start with an analogy like that because I think it actually puts a framework around what I expect medication to do, which is not solve everything, but be a really integral part of treatment. It also highlights that not everyone who's in the middle of the sea in a sailboat needs medication immediately. Not if they're not drowning, maybe they just need to organize themselves around in their boat to figure out what they actually have. So I think it gives me room with the patient in front of me to think about where in this picture do you feel like you are? And I find it's much easier for them to be like, oh, you're right, doc, I'm drowning. Like nothing is working. Or I actually do think I can do this, but maybe I just need a little bit more help organizing. And that's typically where we'll start.
That's what a gift to be able to share that with somebody and allow them to find themselves in that picture. That's really powerful. Thank you for sharing that. I'm sure that the audience is going to really value that and find that useful.
I think my patients, it's been one of the key things that it's been really helpful to kind of close this gap that's between me, the doctor who has this prescription pad and theoretically knows all the textbook stuff, and you, the patient, who's experiencing things in real time, and sort of for us to come together in an understanding in ways that is void of clinical words and big things, but also makes clear what our goals are together.
Yeah, I feel the same way.
Yeah.
It really is an honor. So let's talk a little bit about like myths and misconceptions. What are some kind of common misconceptions about medications that you've referred to them a little bit, but what have you heard?
Yeah. So one of the biggest things I would say is medications are going to control me. I'm going to take a medication and it's going to just take over, and I'm going to lose all control of who I am. And I get that. I mean, many of the medications that we use can sometimes be really overly sedating, and sometimes my patients feel like zombies or have been in practice where they've felt like zombies. But the role of medication when done appropriately is not actually to control anything. It's more so to give you the foundation that you need to be you, the person that you are. And I often will remind my patients of that. When medication is working well, it is bringing you closer to the healthiest version of yourself. Mm-hmm. If at any point we start to take a medication or we start and initiate a medication and you start to feel like you're separate from yourself or distant from the person you know yourself to be, like going in the wrong direction, that's why I find it important for us to have a relationship, and a therapeutic relationship in which you can tell me that. Mm-hmm. So I can know that medication A at dose X does not work as well for you. Either it makes you feel too blunted, like not really feeling things, or it makes you feel too sleepy. That's not my goal. Now, the reality is we have all sorts of medications, but I will always remind the person in front of me that they're the first them that I'm treating in my career, right? And so even though I know that the last person walked out and it worked perfectly at this dose for this thing, that's not necessarily what's going to work for them. It's a little bit of a dance. As you can see in my practice, we use a lot of pictures. That's kind of how I think, and that's how I find I'm able to relay information. But this really is a dance. We're entering into a dance. We're new dance partners, and we got to kind of learn our rhythm together. And it's not going to be the same one for you as it was for the other patient. And so this idea and this myth of medication's going to control me, I can appreciate where it comes from, but also if that feeling is coming up as you're starting medication, those are really important things to let your provider know, because that may mean an adjustment might be needed or this medication just isn't it.
That's the power too of knowing common misconceptions, but also as a provider, not being dismissive.
Exactly.
When you hear something.
Exactly. I mean, you well know that oftentimes our patients are working to express something the best way that they can.
Yes.
Right? So when my patient is coming to me with a specific concern, they're doing so because they're trying to express something. Now, it's coming out in a way that to another provider might feel like, what are they talking about? That's not even a real thing. But there's an experience that's happening there. And my job is to sort of figure out, what is that experience, and how can I adjust it so that way we are back aligned at the same goal? Because everything is coming from somewhere, regardless of how it's showing itself or the words that are being used to describe it.
Yeah, absolutely.
Yeah.
And to your metaphor point, I try to limit myself to 3 to 4 metaphors per session, but sometimes I might just have to say, forgive me. Right?
No,
yeah.
I know, but you know what? I find that my patients are along for the ride. Frequently it's not uncommon that people that I work with, their experience, particularly when they're working with their physicians or psychiatrists, has been kind of a open the door, here's a thing, write a prescription, exit. So I find that this fun that we can kind of have, and having these conversations and painting these pictures is also an experience very different sometimes than what they've known, and also allows for some trust, like you've spoken about, allows for building a relationship and ultimately creating a therapeutic bond that's really going to get us to where we want to go.
Mm-hmm. We named this a little bit, but there is this history and this fear within the Black community about over-medication or psychopharmacology or the pharma business being invested in us being medicated. And how do you speak to that with patients? What do you want people to explore for themselves in that, as they're struggling with, with that history, with, some of the real questions that come up around that?
Absolutely. I mean, I think the first thing is validating that. I mean, there is a real history there. No one can tell you otherwise, and if they do, then they don't know history, right? So there is a very real history there that needs to be paid attention to. But that's why I think it's so important that you, a patient, is entering into a therapeutic relationship of trust with the person in front of you. And honestly, that might not happen the first session. The first appointment may not be the time that you're like, I completely and fully trust this person. But the idea is to build towards that. Because the thing that gets us from point A of skepticism and fear to point B of what is this decision that I'm making for myself that might actually be helpful, or how can I follow through with a clinical recommendation, is trust that the person in front of you actually has your well-being as a priority. That they're looking at you as a full and whole person and treating you as a full and whole person. And so I think the first thing and the most important part is finding and engaging with providers that you can trust. Once that trust is there, it's sort of amazing how many things you can sort of break through, and barriers you can kind of get over, and things you can move through, challenges you can overcome, because there's trusting relationships. I don't get it right every time as a doctor, right? And I really rely on the trust of my patients. And when I get it wrong, my patients can come back and say, yeah, doc, that didn't work exactly the way we want it to, but we're still here. We're still journeying together. We're still dancing together. We're still trying to figure out, because you know that I wasn't just throwing darts at a dartboard. You know that I was intentionally making a decision that didn't go the way I wanted it to go, or the way that you wanted it to go. So I think finding and building those trusting clinical relationships is probably going to be the first step, and not invalidating the fact that there are very real fears, but that's our job. Our job is to work together with our patients and meet them exactly where they are.
We talk about trust, right? How can patients know or build trust, know that they're in a trustworthy relationship, or build trust? Can we talk a little bit, go a little deeper and talk about what trust looks like with your psychiatrist?
So one of the first things that I would say is that patients need to be able to ask the questions. All the questions. The ones that they think are silly, the ones that they're typing in Google, especially the ones
especially
typing in Google. You need to be able to ask the questions. You know, when you are working with a provider that you trust, when you find that more and more you can just ask the questions without working yourself up to do it. In the beginning, it's hard. And the way you start building that is you kind of start testing a question, right? I'm gonna ask about this sexual side effect in my case, or my patients may sort of throw out that there's been this substance they've been using on the side to try to alleviate the anxiety, to gauge a reaction a little bit. You're gonna test it a little bit, and that's reasonable, but you know you're building a trustworthy relationship when you just, come in and sit down. I mean, some of my patients come in and sit down and like, okay, well, yesterday I used this much of this, I overtook this thing, I stopped taking this because, and they can just kind of go through this list of things your doctor really doesn't want to hear, right? I wish that weren't the list. And also the fact that you're able to come in and do that allows me and frees me up to do my job, and allows me to do my job well. At the beginning, we talked about the difference between a psychiatrist and a psychologist and how I am medically trained. When I'm working with medications, it's so important that I know what it is you're doing and not doing. Not for judgment, but truly just to make sure I'm making informed and safe decisions for you clinically. So when I know what you're doing completely, whether I would advocate for it or not, that allows me to do my job well. And you know when you can trust your provider. I know when I'm in a trusting relationship with my patient, when they can just say it all, knowing that it's not exactly perfect and it's not necessarily what I want to hear or what our goals were, but that we can work from there. And I think having and being able to ask questions freely, you know then if your provider can listen to you and that's someone that you're able to trust.
We want the best, we want ease for our patients, but for our therapy and for our work with patients, we want truth and authenticity.
100%. And quite frankly, that allows us to do our job better.
Yeah.
And it's best service of the patient to get them to shore.
Yeah, absolutely. We could talk so much, but I think what you have shared is going to be so helpful for people. Thank you for your imagery, your metaphors, right? You know I'm here for it. And just for joining me in conversation. So
Absolutely.
Grateful.
It's my pleasure. Thank you for having me.
Yeah, thank you. On the other side of a short break, we'll wrap up this week's show with the closing session. Stay with us.
I'm Andy Zopp, the host of Chicago Newsroom 2.0. Every week, we gather for insightful conversations with local journalists and community leaders as we discuss the news of the day and how it impacts the lives of Chicagoans. Join the conversation on CAN-TV Cable Channel 19 or stream live on cantv.org or on the CAN-TV Plus app. Hyperlocal news and critical analysis. Experience the power of community television.
I am so grateful to my friend and colleague Louisa for joining me in conversation about this important topic. We've taken a deep dive into some of the key differences between psychologists and psychiatrists. We've talked about how each plays a unique role in helping us, whether that's through exploring our inner world in therapy or through understanding how biology and brain chemistry impact our emotional lives, behavior, and relationships. And just like last week, this is the time where I extend an invitation to you to reflect, to gently investigate some messages you've received. So what are the messages that you've received about psychiatric medication? And maybe more importantly, where did those messages come from? Was it something a family member said when you were younger? Was it the idea that needing medication is a weakness or something to be ashamed of? Was it tied to fear or mistrust of the medical system, or maybe just a desire to just be strong and push through? The messages we received in the past often become the scripts we enact in the present, and not all of them deserve that distinction. The messages come from our families, our cultures, our histories, and even from our trauma, and they deserve to be examined with care, not shame. And when necessary, they might also require revision. Hopefully, this reflection will help you explore whether the beliefs you hold about medication still serve you now. To be clear, you don't have to change your mind today. You don't even have to jump into a decision, but you do deserve space to explore your beliefs and perspectives and to update them when you're ready. That's our time for this week. Keep reflecting, keep asking questions, and most importantly, keep the dialogue going, whether with us, your friends, or within your own community. And remember, the conversation doesn't end here. Join me at bewell@cantv.org and at Dr. Norcott on Instagram. We'll be back next week with another deep dive into a topic that matters. Until then, take care, stay curious, and be well together.